Okay, so we are going to make an interview with Mr. Hanuman Singla, who is the patient of neurotherapy. So, the first question from me to you, how did you know about neurotherapy center in Jalandhar? From TV or radio or from some friends, relatives?
My friend
recommended to you, yeah?
Yes.
And,
My friend Ramesh Mittal.
And what kind of suffering did you have? Why you choose this neurotherapy?
आपको क्या किस वजह से चूज किया क्या जॉइंट पेन?
मेरे joint pain था इधर.
Problem is your
joint
pain here.
Having a pain in the joint.
Doctor is advised to replace the joint. Replace joint. But my friend Ramesh Mittal ने suggest किया भी आप.
He suggested that you'll get better benefit from the neurotherapy rather than replacing your joint. Rather than operational, being in operation.
7-8 years old.
Yeah.
Before.
Okay.
We are okay.
And how was your first appointment in this clinic? Were you satisfied with reception and?
आप satisfied the reception service वगैरह से?
100% satisfied.
Okay. And what about cleanness and appearance in the clinic?
वहाँ पे सेंटर पे कैसी साफ सफाई है, कैसा माहौल है वहाँ?
Best.
So you are very satisfied with everything.
Satisfied and Dr. Ram Gopal and Paramjit Kaur both यानी अपने दिल से अपना इलाज करते हैं.
They put their best effort to treat the patient in the best way.
And what about the price? What do you think about the price? It is normal or expensive or cheap?
It's
cheap, very cheap.
Cheap.
Very cheap. यानी poor to poor भी जो आदमी है.
Every people from every caste and religion and every from every society, they can afford to come there.
So we are very satisfied and prices are very cheap, yeah. And
no side effect.
And there is no side effect of this therapy, especially.
आम ये नहीं जो गुड्डों का जड़ा इलाज करते हैं वो painkiller दवाई देते हैं.
Like in hospitals, they used to treat with the painkillers or with the medicines that do have side effects in the later years. So this neurotherapy is having no side effect. So it's beneficial to the patients also.
Do you feel that it is helping to you, this treatment? Do you feel some improvement with your knees?
Very improvement.
And how often are you visiting?
कितनी बारी जाते हो generally आप?
पहले after before 7-8 years.
So 7 years, yeah. And how many times in 1 week?
First 3 months daily. First 3 months daily. 7 years old. Before 7 years old.
But how often in the week? Yeah. 1 time a week or 2 times a week?
Initially used to go every day.
Every day 30 अपने 60 days.
So every day.
Every day. After 1 week. Then after
3 months.
3 months, 2 months.
And you
first 60 days every day. After then per week. After 1 month, 2 months, 3 months.
And how long in 1 day is a treatment? It's 1 hour every day or half an hour?
एक दिन में कितने घंटे करते हैं treatment?
15 minutes to 30 minutes.
And if you will finish this, so you think that it will be worse? If you will finish this treatment, so you think that your knees will be worse, yeah?
Sorry?
If you will finish, if you will not come more to this clinic, so you think that it will be worse?
No, it's definitely helping out. It's definitely helping out the knees. It's not a worse treatment. It's good for the knees, rather than getting operational.
But he needs every really often, yeah, a visit at this place.
Because he feels improvement in his knees. That's why he's used to go daily. Initially he used to go daily, but because of lack of time,
first 60 days he daily जाना बनता. After then 1 week or 1 month.
As per the procedure, he used to go there. As per their requirement, like they say, you need to come once in a week. So he go as per the schedule.
Okay. And my last question: do you have some suggestion how we can improve our service or any complaints?
Complaints?
Complaint तो कोई नहीं है, no complaint. Service अच्छी करनी वैसे ऐसी camp भी हुआ है
अच्छा. Like he's recommending that the camp should be placed in the rural areas and the backward areas so that the poor people can be benefited from this. Because it's very cheap service, so almost everybody can afford to acquire such services.
Okay, thank you for your answers. And if you can please fill in this form